Good afternoon. My name is Katrina Wright, and I'm going to be discussing prenatal care, which is a global health issue, especially one that we experience here within the United States. Specifically, according to the March of Dimes, the states that are affected by not having accessibility to prenatal care is in North Dakota, South Dakota, Alaska, Oklahoma, and Nebraska. Now, we're going to discuss prenatal care and postnatal care. Receiving prenatal care during a pregnancy is very critical and important. You can identify and diagnose and treat, prenatal problems that are occurring. So that can affect the mother. It can affect the unborn child. Sometimes there's tumors. Sometimes there's brain. Abnormalities or things within the spinal cord that they're able to easily diagnose through the use of technology such as ultrasounds. When mothers are unable to receive this kind of care, have access to ultrasounds and doctors who are able to diagnose these problems, they give birth to unhealthy babies. Sometimes the risk can impact the mother. Sometimes you might need a C-section because a condition that the baby has that could affect the mother. The biggest thing is to try to reduce maternal death and newborn as well. You are able to have this option through blood work, ultrasounds, testing, and so forth to try to prevent these problems from occurring. So you go every couple months throughout your pregnancy. It gets a little bit closer towards the end. According to the March of Dimes, they state that one third, so 36% of U.S. counties are considered maternity deserts, which are defined as counties without a hospital or birth center offering obstetric care and without any obstetric providers, impacting women before, during, and after pregnancy. A lot of things that there's issues regarding this is legislations, programs, funding to counties with maternity deserts, no access to family planning, accessibility, affordability, awareness, education, and on a government level. Another thing is, according to womenshealth.gov, babies of mothers who do not get prenatal care are 3 times more likely to have low birth weight and 5 times more likely to die than those born to mothers who do get care. So that's very important to obviously have prenatal care. Another thing, according to the CDC, differences and changes in prenatal care utilization during the pandemic among the race and Hispanic origin groups studied may have been influenced by the shift to telemedicine or virtual visits for healthcare for mothers during pregnancy. Now, if mothers were not receiving prenatal care during the pandemic, that may have resulted in poor outcomes for the mother, the child, and it is a health issue because um, women may have needed to be diagnosed with certain things during their pregnancy that is serious. The pandemic affected a lot of people receiving care, whether it's prenatal specialty or just standard care. However, um, this is a problem that not only the United States has, but other countries as well, about having access to quality healthcare and using it as a preventative. So it's super important for, like the March of Dimes to set up these programs and try to reach legislation, the government, and et cetera, to try to provide access to these quality care standards to mothers, for healthy infants and healthy mothers.